Good evening, it's Bill Taylor from Edinburgh again. This is the second video that I've made looking at giving you some ideas to relax your pelvic floor. And this week I thought what I would do is use something that I use in the clinic quite a lot, these kind of semi-compressible spiky balls, and run through some of the kind of common exercises that I use in the clinic when I try to teach patients how to self-care at home. Okay, so here we go. First thing to do is you're going to lie on your side. For this you need like a little yoga block as well. And what you're going to do is you're going to put the yoga block on the floor in front. You're going to put the ball on top of it. And this is for your inside of your thigh. Okay, so for your adductor muscles, which are all kind of important in pelvic floor function. And what you're going to do is you're just going to roll, just lie, put your leg on top of the block, on top of the ball, take a breath in, breathe out. When you breathe out, you're just going to let your leg sink into the ball, keep yourself as comfortable as you can, and just lie there with your leg with the weight on the ball for up to 30 seconds, even a bit longer if you feel that's something you want to do, but definitely 30 seconds minimum is good. You can actually roll backwards and forwards if you have tender areas in the muscle. Some people call them trigger points, but let's just call them tender areas for today. You can roll gently to try to desensitize those areas, try to switch off the overactivity in the muscle. You can do it with your breathing, so you can breathe in, breathe out, breathe in, breathe out, roll backwards and forwards. If you get a spot that's particularly tender, then you can stay on that and just keep there, okay? Hold it in that spot. You can flip over and do the same on the other side, or if you want to just do one side, that's fine as well. There's no reason to do both if you don't want to, or if both sides aren't tight. But sometimes to balance it out, both sides is quite useful. Second thing we're going to do is this time we're going to get two balls. This time we use the block for our head. Take the other ball from here. Going to raise that a little bit. Yeah, so what you're going to do is take the two balls, put your head on the block or a pillow. It doesn't have to be anything too fancy. Take one ball, put it in the soft part, fleshy part of your glute max, or your main glute muscle. And when you get there, you're just going to take your time to find the space that you think's right. It sits on either side of your sacrum bone, which is the big wide triangular bone in between both of your hip bones. And you want to find that area. And when people have tight pelvic floors, they often have tightness in the glutes, which is connected to the posterior pelvic floor. The tightness in the adductors can often be connected to the anterior pelvic floor, but not exclusively. But oftentimes if you're tight posteriorly, then switching off your glute muscles is quite a nice thing to do as a precursor to any more work that you might do on your pelvic floor. So I would get into this position. Again, I think in the first video we were talking a lot about breathing. So hands down by the side, breathe in, breathe out. Just let your bum and your glute muscles sink into the ball. Breathe in, breathe out. And as you lie there, you'll feel a sense of it getting become more comfortable, maybe not quite so resistant to the ball going into the tissue. Or if you do this and you think, no, I'm not feeling very much and I want to progress it, then the next thing to do is to lift one leg up in the air, like so. And then just stay there, breathe in, breathe out. Put it back down, breathe in, breathe out. Pop it back down, breathe in, breathe out. Again, just going nice and slow, letting everything relax. Maybe do 5 on each side. With the adductor trigger point or desensitization work on the inside of the thigh, which is the first exercise, you can stay there for 30 seconds, but repeat it 2 or 3 times. There's no specific number, there's no science behind the number. It's really about what you feel comfortable with and how you get a change in your symptoms. Another way of progressing this, which is one of my favourite ones, is you're in this position here, hands on here, breathe in, breathe out, and when you breathe out, drop your leg out to the side, and that really increases the amount of pressure that's going through that glute muscle. You have to be a little bit careful in there because it can be quite close to your sciatic nerve and piriformis. So if you're getting tingling or pins and needles, you might want to back off a little bit, reposition the ball so you don't get that sensation. Breathe in, breathe out, do the other side. That really increases the pressure. Come back up. What you can also do, progress it a little bit more, breathe in, breathe out. Drop your leg down. Slide your foot down here, bring your foot back up, slide it down, maybe 4 or 5 times up and down the bed. Every time I do that, I'm getting different areas of the muscle and a little bit more tension with the ball in. Come back up to here to finish off. Breathe out, pull it back up. Same on the other side. Down, come back up to the top, nice and easy. Big breath in, breathe out. Now you can, if you want to do some diaphragmatic breathing instead of lateral costal, put your hands down underneath your xiphisternum, which is the pointy bit on your chest. Put your fingers in here, make a fist with each hand. Breathe in and push your belly out. Breathe out. Breathe in. Breathe out. All the while still lying on the balls. Then we can take these out. Next exercise that I'm going to show you, because I'm just going to show you a few different ones and you can try these, see which ones work better for you, is if you tend to be tight across the front of your hips in here, or the discomfort, or say the tension that you hold is more anterior in your pelvic floor, then one of the things to do is to lie on these spiky balls. So you basically put them down about here. So the floor in this room is a little bit wonky, so they go off in a different direction. So you come down onto your tummy, you put them in the cusp of your hip. So if you look at your hip, if I come back out of there, and these balls will go everywhere, you put them in here, almost like if you put your hands in your jean pocket, where your fingers would end up. If your thumb was hooked over the top of your pocket, your fingers would be pointing down to your genitalia, but your fingers would be sitting in this kind of nice crease. It's a soft crease on the front of your hip, and that's where you want to put the balls. Okay, so you can lie back down, you can lift up, just gently put them in there. There's lots of structures on the front of your hip, nerve, arteries, veins, and you want to make sure that you're not directly on one of those structures, although you want to make sure it's comfortable. You don't want to increase any pain that you already have. And again, you want to breathe there just for a little while. So breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. So you can change this a little bit and up the amount of pressure you have on it by simply bending one knee up towards your bottom, come back down. Bend the other knee up towards your bottom, come back down. And you breathe in, breathe out, stay there. Breathe in, put your leg back down. Breathe in, breathe out, stay there, breathe normally, come down. So that gets the front, okay? So those are just a few really simple exercises that you can do. Again, you do them within your own comfort zone. You don't produce any pain. It's about trying to desensitize the muscle. It's about trying to switch it off, connect it a little bit with your breathing, and definitely pay attention to anything that you do that makes you uncomfortable or doesn't make it feel good to do these exercises, because then I don't want you doing them. So anyway, I hope that's useful, and nice to see you guys again. I think I've got a couple more videos to come up this week, so hopefully you'll like this one, and my next pelvic floor video I think is going to be much more dynamic and up off the floor, and how I get my pelvic floor patients moving and using the pelvis in a more functional way. Anyway, thanks for listening, and see you soon.